Hello, if you're joining us, we're starting to see people come into the room. Welcome to friends from Adara as you come in to join our webcast. We're just going to give people a little bit of time to join in. We're very excited to see some of you starting to come and to join this Adara's first webcast. So just give a few more minutes here, hoping you can see us all, or a few more seconds here. All right. Welcome. I think we can get started. I can see there's a few people coming into the room, and we want to make sure that we keep on time. I get the great good fortune of introducing the Adara team to our first ever webinar. Thank you so much for taking an hour out of your day to come and hear about the work that Adara is doing. My name is Audette, and I have the huge privilege of being the chair of the Adara Group worldwide, and this is our first ever webinar, so it's quite an exciting adventure for us. We've got I'm here on the virtual stage with four of the most senior leaders of our work globally, who are going to get a chance to speak to you all. It's an enormous privilege of my life, actually, to work with the people that you're seeing in front of you in this screen. I'm going to give you a quick 2 minutes on Adara. I know many of you know about who we are, and then I'm going to throw to the team so you can hear about the work that we've been doing this year. So we themed this webinar, Respond, Rebuild and Reimagine, which is the way that we're theming our work in 2021. What we wanted to do today was give you a snapshot of what is going on in our project sites and in the developing world more broadly, and then talk to you about where we're going from here. As many of you know, Adara works with across two lines of focus. The first is service delivery to people in extreme poverty in remote places, and the second is a knowledge sharing pillar, where, if you like, we try to scale our work by sharing our knowledge, including stories and information about our mistakes, so others can do more work in the areas that we're specialists and take our learnings. We focus on two areas particularly that we're specialists in. The first is maternal and newborn child health, and particularly care to tiny wee babies, our littlest clients, preterm and low birth weight babies in places that are low resource settings. So you hear more about that from the wonderful Dan Kabugo, who leads our work for us in Uganda. We also, in our second limb of specialty, is very, very remote, loosely health and education service. We are amongst the remotest service deliverers in that field of expertise in the world, and we've actually got beaming in from one of our most remote projects, the wonderful Anjuk Lama, and also with us Prahlad Dakal, who leads all our work in Nepal. So as you listen to the presentation today and ask the questions, that's the frame to understand our work from here. So with that very outlined setting, I'm going to throw to an extraordinary woman on our global leadership team, Maddie Vaughan, who's been with us for 8 years, and who is a senior programs director for us, and who works across all our work, both remote community development work and maternal newborn health. So Maddie, over to you.
Thank you so much, Odette, and thanks everybody for joining us today. We're very excited to be hosting our first webinar. As it is our first webinar, I do ask that you bear with us if we have any technical issues as we learn our way through this, but hopefully it will be smooth today. Just first off, I wanted to let you know that we are recording today's webinar so that anyone who missed out can catch up on it later. So the other thing I'd like to say is please bear with us if we have any internet issues. So as Odette said, our team are beaming in from Kathmandu, from Uganda, and from Humla in Nepal, which is very remote, way up on the border of Tibet and the Himalayas. And so the internet is a little less reliable than we would like. So bear with us if our participants drop out. One of their colleagues will definitely pick up and help fill in the gaps while they try and reconnect. You might notice that some of my colleagues are also on the webinar. They're here to just help with anything today, and they might be messaging you in the chat if you have any questions throughout the session. So today, as Odette said, you're going to hear from our teams in Uganda and Nepal, and they're going to share some of their reflections on 2020 and some of the exciting plans that they have in store for 2021. We're also going to open for a Q&A with our wonderful audience. And to facilitate the Q&A, you'll have two ways of asking a question. So any question you want to ask, please press on the Q&A button at the bottom of the screen on your Zoom screen and type your question in there. If you were interested in asking the question live, you can press on the raise hand button, and we will, when we get to your question, we'll let you speak, hand over the microphone to you to ask it. If you don't want to ask your question live, that's totally fine. You can leave it in the chat box and I'll ask it on your behalf. And you are also able to ask questions anonymously, so feel free to do that. The other thing is that we have a chat function. So throughout the webinar, if you want to say hello or send some love our way, feel free to put it in the chat box. And you can also ask questions in there. Our team will keep an eye on that as well. So to get started, we'd love to ask you to pop in the chat box where you're tuning in from today so we can see where everyone is. And as you do that, we'll get started and start the webinar. So I don't need to say to anybody that 2020 has been quite a year. Everyone in the world has been touched in some way by the coronavirus, and it's disrupted the ways that we work, the way we socialize, the way we connect, the way we live. And for us at Adara, it's been quite a year of upheaval and challenge, but also a really amazing year of reimagining and innovation and inspiration. And in spite of all the lockdowns and curfews and logistical challenges that COVID has thrown our way, I have to say our teams have managed to maintain essential service delivery to some of the world's most remote communities and have managed to maintain a smile while they do it, which I think is pretty remarkable. Our teams on the front line haven't blinked. They've donned their PPE and redesigned their service delivery and just got on with the job of making sure they're improving the lives of their communities. And I couldn't be more proud to work with these people, and I'm so excited that you get to hear from them directly today. So despite the physical distances between our team that COVID has made a reality this year, I do feel like the organisation is closer than ever. And it's been a truly multidisciplinary effort this year, with all members of the Adara family, from our business team to accountants to anthropologists, lawyers, midwives, fundraisers, public health experts. Everyone has been stepping up and delivering their best work for us to continue our services during 2020. We've just finished several big weeks of planning our future, and we're anticipating another tough year next year of challenges, but I'm really excited that the team are going to share their ambitious vision for next year, which I know is going to change the lives of so many people. So it's now my great pleasure to welcome our first speaker for today, an incredible man, an incredible leader, Mr. Daniel Kabugo. Dan is Adara's Uganda country director, and he leads all of our work in Uganda, and he does it with deep compassion and humility. And he's done such an amazing job in 2020, imagining how we redeliver our services and making sure his team and our partners at Chiwaka Hospital are able to continue their work safely. And in the face of lockdowns and curfews and even a COVID outbreak that affected our partner Chiwaka Hospital back in August. As a country, Uganda's done an admirable job in controlling COVID, and cases in the country are at around 17,000 right now. But cases are continuing to rise, and testing rates in the country are extremely low. So we don't have the full picture really of how severe the outbreak is. And you may have seen in the news that right now, alongside this challenge of COVID-19, Uganda is also experiencing some escalating political tensions and violence in the lead up to the election, which is scheduled for the 14th of January next year. So just yesterday in Uganda, 3 people died and 38 were wounded in political protests that are surrounding the election. And it's within this very complex context of COVID and political tension that Dan is planning a very ambitious program of work for next year, while simultaneously keeping his family safe, his colleagues safe, and just making sure that the work pushes on. So with that little intro, I just want to hand to you, Dan, to ask you if you could share with us how COVID changed Adara's work in maternal newborn child health this year in 2020.
Thank you, Maddy. And thank you all the friends who have joined our first webinar. I'm very excited to be part of this. I'm a little bit introduced, and that's enough really for me. I will go straight to the question. Adara changed really our approach as we were faced with this pandemic of COVID in many ways, but I want to highlight a few of those ones. And one of them was the safety. And the safety was number one for our staff, but also our partner, the health workers, and also the communities that we work with. So for us, we really agreed as a team, and I want to thank our leadership that the crisis management skills, decision-making was so fast, that we could not wait anymore, even consult. And we had to refocus our resources to make sure that our staff are safe, partners are safe, which is your hospital, RSA workers, but also the communities that we serve. And how did we do this? We did this by making sure that we source enough PP that was required. Either was through in donations, either we are making locally or buying on market so that really we have enough PP. We have a small office where we sit as 8 staffs. So we went ahead to see what can we do as a data staff to make sure we are safe. So we had to come up with other measures of really working into smaller groups. And we divided our office into 2 other spaces, a data house, a data office. And that was really trying to make sure that we have safety for all of us, but also social distancing was really in place. And that was so remarkable to make sure that priority is for staff, the communities we work with, but also our partners, your hospital. But also we not stop there. We continue to make sure that we engage other local communities still that we work with to make sure also compliance is there. And then we continue to work in hand with your hospital, which has been amazing. So our focus was really to make sure that our patients are cared for, but also cared for in a manner that really protects them from this COVID. So the priority was really about patient, but also how do we do it in a safe way? Because there is workers, we needed to be protected, but also the services need to continue being delivered in this hard situation. And we are seeing remarkable results of this with the compliance issues, the Choko hospital team, management, and then the COVID team working together with Adara. So that's been amazing, though very difficult, but because of the support from Adara and all the friends, we are gone far, and we believe we'll continue working together in this area.
Thanks, Dan. I think that's such an important point, that health workers are at such high risk and they're so critical to keeping all the other services. All the babies are still being born and the NICU is still running. And so it's so important to protect them. So that's great.
And I see that we've got Dr. James on the line with us from Chiwoko Hospital. And Dan, I'm so glad you called out the incredible work of the hospital, and Dr. James and Dr. Peter and the team leading to keep everybody safe, working. And it's been such a privilege for us to work with Chiwoko.
Absolutely. Thank you, Odette. Dan, I know that you and your team achieved a lot this year, but if you had to pick one greatest success that you're really proud of, what would it be? And what would be one of the greatest challenges that you faced this year?
I think for me, the greatest achievement this year, I have done interviews with the staff one-on-one, but I must say that all of them have confessed the safety issue. They have felt comfortable because most health workers in Uganda didn't have enough PPE to use, but also they were frontliners, they were working, so their life was at risk. But because of the support of Adara working with Choko Hospital and other partners, the staff themselves felt comfortable working. It was not easy, and it's not easy, but they feel they have enough equipment they need to do their work. So that for me makes it all. But also the challenges still have been looking at how people in the communities don't really perceive this. It is still in my mind. They don't really believe that COVID is real. They don't believe that this is something so serious and dangerous and kills. Even yesterday when I was talking to people, they still doubt this. And this is alarming, but because we still live this with COVID, we are with this community, it's a challenge for all of us because we need to make sure we sensitize, work with the people, support them, and then make sure the attitudes change towards this.
Thank you, Dan. On the first point about the success of the staff feeling safe and able to continue their work, can you share with us how, maybe an example of how the team have kept going with the PPE and been able to continue the work that they're doing this year?
Yeah, thank you so much. So the staff at Choko Hospital, but also other places we work with, like Nakasu Hospital, which is a public health facility, we have been able to give. So Choko Hospital has been amazing, but working with Adara in such a way that we have been able to work with the leadership of the Choko Hospital in terms of forecasting in their need of PP. So we have been able to Paluchua, but also have been working with other people from China, like Peter, donating us PP to the hospital. But also the technical team at the hospital, they have been able to project, give us numbers, what do they have in stock, what is the balance, and that has been a success because this has been also through communication with other leadership on a weekly basis to make sure their projections are okay, do you have enough stock, and we remind them and we work together, and that has been amazing because each person knows that we have enough PP, which is given either daily or weekly, and they use per week. And that has been fantastic because they see their colleagues outside the Chok Hospital struggling not to have PP, but also they have to do their work. So this has been amazing as we have been doing and working together with Chok Hospital.
Thanks, Dan. I have to say, I've been so inspired to see our team, and the team at Chiwoko, now that they have these tools and they feel safe, that they're able to keep, saving babies' lives and keep doing follow-up with VHTs in the community and keep these services running because of that. So I think you raise a really, really important point there.
And the protocol, maybe just one other thing I meant to mention about the protocols. The government has protocols, Chok Hospital adapts them, but also Adala team worked with Chok Hospital so hard to make sure that those protocols are in place, followed, and then to make sure that everybody is safe. So WHO, Minister of Health, Choko, Adala, it has been ongoing work, and it's amazing to see this around the hospital.
Yeah, thanks, Jen. So we've just come to the end of a busy few weeks planning our 2021 strategy. And I know there's a lot in the plan and we won't have time to cover it all, but can you share with me some of the things you're most excited about from our plans for next year?
Thank you so much, Madi. We have finished, as you said, the planning phase, but one of our plans is really to continue to do the preventable maternal newborn and the child death through Adala newborn. And another newborn is really going to focus in the first phase, Nakasek Hospital. Nakasek Hospital is a public health facility which is near Chok Hospital, and we went there 2 years ago. And we want to start this work there, and then we want to build it to another level, which we will call level 2. And the idea is to make sure that we see more babies being saved, but also more babies who are coming to Choko, really who are not very sick, can be managed at that hospital. So we want to enroll that in this new plan. And the ultimate goal is to make sure that really we work on this preventable, but also make sure that the communities that we work with really live, but also survive as these babies. So we are so passionate to see that this work begins at Nakasek Hospital, and then we shall be doing training, but also part of the training goes with our mentorship idea that we have been doing. We train, but also we keep mentoring using our global relation manager, our wonderful sister Christine. So we are so excited to see that the training goes, but also we have other health facilities that we want to work with in the public sector. And that will be Kawempe. We can't do everywhere, but we are talking with the Newborn Standing Committee, working with the ministry, and we want to see that more lives are saved through our mentorship idea, but also training as we see how all this works out. We know COVID will still be there, but we know we are going to work in this area as we safeguard ourselves and our community that we work with.
Thanks, Dan. It's such an exciting chapter for Adara. I think this taking what we've managed to achieve hand in hand with Chiwoko and sharing it with other facilities and trying to get more newborn units established. And as you said, we started with Nakaseki 2 years ago, and now we're ready for phase 2 in that project. So I'm also very excited about that work next year. And I could ask you questions all day, Mr. Kabugo, because I love the work that you do, and I'm excited about all the plans that we have, but I know that we don't have a lot of time. So I'm going to wrap up here, and hopefully the audience will have some great questions for you down the track. So stay on the line. And I'm going to now take us on a little journey across the other side of the world to hear from 2 of our incredible team from Nepal. So joining us today is Mr. Prahlad Dakal, Adara's Nepal Country Director, and Mr. Angjuk Lama, who's our Nepal Program Manager. And Prahlad is joining us from Kathmandu, and Angjuk is dialing in, as we said, from Adara's most remote project up in Humla, way up in the Himalayas. And it seems very obvious, I think, to say that 2020 has been a hard year, but for Nepal, I feel like they've had a particularly challenging time. And we are really fortunate to have these 2 men leading our work in the country. They have done an outstanding job. So not only has Nepal been dealing with a really serious outbreak of COVID-19, the country now has over 213,000 cases, but Nepal is also a country very vulnerable to natural disasters, including floods and landslides. And this year's monsoon season swept across the country, and we saw a lot of people in Nepal tackling these 2 crises at once, trying to deal with COVID and also trying to deal with the impact of monsoons and landslides and floods. And sadly, many lives were lost this year in those crises. And over the past week for Adara, the reality of COVID has really, really hit home for our teams in Nepal, with an outbreak in Yalbang School up in our most remote project in Humla. So our team, we're so lucky that they could actually join us today, because our team have been working around the clock to respond to this crisis after 36 staff and students at the school and the hostel tested positive to COVID with rapid test kits. We're now confirming these diagnoses with more accurate testing with PCR tests, but it's been quite a journey this week. Two of the staff developed quite serious illness and had to be referred for further care. But for the most part, the rest of the cases are reasonably well, and their care is being managed in the isolation centre that's been set up in the school. And while this news was really shocking for us, it was also something that Adara had been preparing for all year. And I have to say, for a place that is so remote, you know, to give you a sense, you can see it in Prahlad's background, actually, that's the school that we work with, but there are no roads in Humla. So to get around, you have to walk from village to village. It's an incredibly remote community. And as such, the health services there are not as developed as you would experience in a city. And so we've been trying to prepare the health workers and the community in Humla to do as much preventative work as we can this year. And so we were very ready to respond when this crisis emerged earlier this week. And we've only really redoubled these efforts in the past week. And I have to say, my huge credit to Prahlad and Angjuk, who responded so quickly and have done a brilliant job in getting all of these measures in place. So just to start off, I might just hand to Angjuk, and I hope his internet can handle it, and just ask him to give us a bit of an update about what's happening with this COVID outbreak in Yalbang and Adara's response to the outbreak.
Sure. Thank you, Maddie. Namaste and a big hello to all our Adara friends. Thank you for joining our webinar. So I'm really excited to be able to join this webinar. I'm in, like Maddie said, up in Humla, and I'm really surprised actually. Today my internet is really good. So normally it just breaks down a lot, and a lot of times we have internet issue, but looks like today it's really working well. But please bear with me if it goes down or something goes down. So yes, this year 2020 has been really tough year for us. Unfortunately, we had this COVID outbreak in one of the project schools, the Yalbang schools we've been working with for the last 22 years. So this is really sad. Unfortunately, some 36 students and staffs were tested positive. But then this testing kit it's a rapid antigen testing, but for the more reliable testing, which is called PCR, that we don't have in the Humla district. So for that one, all the swabs that we collect from the students and staff, we have to send it all the way to another provincial headquarters, which is more reliable. So far we have like 4 PCR confirmed cases, but rest of them we are still waiting for the test results. Like Maddie said, and two of the staff, they were quite serious, so we they were being referred to Kathmandu for further treatment. But now their condition is stable and they are improving. But majority of the students and staff who tested positive with the rapid test, they are in good conditions. Few of them had a very mild symptoms. Otherwise, everyone is really good. So we are really working closely with the district health office and the local health team to really monitor their health progress closely, and working closely with our partner SCS, who manage the hostels and the local government, to make sure all these measures are taken, to really make good care of all the students. And so, but we've been really prepared for this. Nepal went into complete lockdown since March, and we've been over the money. It's been over over 8 months now, and we've been really preparing, working closely with the schools, closely with the local government, and closely with the community in really raising awareness, making sure all the health workers and female community volunteers who are out in the community to really raise awareness on social distancing, wearing masks, hand washing, and of course, sort of really training them, and at the same time to equip them with much needed PPE and all, the soaps, this hygiene product, disinfecting all the schools. So basically, we are really prepared for this, and we are at this moment. This is a critical moment for us, and we are really redoubling our efforts.
Thank you so much, Anjuk, for providing that context, and thank you so much for all the work you've been doing to keep everyone safe. I have to say I was delighted today. Prahlad sent through some videos of the kids who were in isolation, who are all quite well, who were dancing and playing volleyball, and they seem to be doing well. So that was very comforting to see. All right, so my next question is actually for Prahlad. And Prahlad, I was hoping you could share a little bit about the ways in which COVID changed our work in remote community development this year.
Well, thank you, Maddie, for setting up the scene and giving all the background, and Anju also talking about the current what we are facing at the moment. So, if I just recall, what changed is in January, our Sydney team, in all Nepal team, we sat together. We thought of doing a huge reform in our health program, education program, much better. Our partners all together, we thought let's make the school back is a more better, other school more better, help us more better. So we wanted to do all our community work more better, but all of a sudden, at that time, the COVID news was there, but we didn't realize that COVID is going to be such a big thing in the world. So we after that, after March, in January, we had a remote community development strategy session in Nepal, audit, everybody were there, all of Nepal staff, but our every focus has been changed when we realized that, COVID is a significant, a big thing. It's a COVID era. It's going to change the era. So we changed our program, and our shift was still health education, but totally different. The COVID is kind of a center. COVID came in the center of everything what we do. So the first thing we started is the bigger thing. Our focus from health and education went to COVID community preparedness. So we had to train people. We had to have a campaign in the community how to fight COVID basically. So with the health worker, prepare them to fight the COVID and help people in a crisis, and at the same time, working with the people to fight with the COVID. So that's the priority gone to that from normal health and education program. And then after in health also, we work in a most remote part of this country, and we wanted to make sure that there was lockdown, no market, nothing. So we wanted to make sure that all our health posts, all our health systems are functional. So we had to shift that. Even during pandemic or this crisis, we wanted to make sure that our health system is functional, working. There is medicine, there is health workers, and health workers are protected with their whatever gear, whatever protection measures they needed. So that's another thing. And third thing is that since we work with a large number of, we have a big family. We have almost many hundreds of children in our education programs in Humla, in Gangphedi, and in youth in Kathmandu. So we are hundreds of youth and children all together in a Dara family. So we wanted to make sure that the classroom education is totally disrupted. You cannot open the school. There was a lockdown. The school is closed. So we want to make sure that that there's we from normal education we had to make a shift to distance learning. We had to run the education classes from the FM radios, and we have to send the home learning kits to the households to the kids. We have to send them devices like radios or like that, and also we had to send them basic protection things like cloth masks and all these things. So yes, health and education, but totally different and totally what you call a shift, a total kind of twist in our program, Mary.
Yeah, absolutely, Prahlad. I think the word pivot has been used so much this year, but it really is what the Nepal team did. You just kind of shifted a little bit, but kept going and made sure everyone still had health and education. And, you know, I love hearing about getting PPE to Humla, this remote places where it travels from, you know, a 12-hour car ride up the country, then on a plane, then on the back of a donkey up to the health post. It's just incredible how quickly you managed to protect the community. So well done. Okay, Prahlad, I also want to ask you the same question I asked Jan about, I know there's so many successes that you had last year, but if you had to pick one that you're really proud of, what was the greatest success from 2020?
I think I may be a little bit repetitive, but I would again say preparedness. You know, so far, thank God, luckily, none of our staff and youth, you know, they are seriously ill of COVID, and all of our people are safe, and we are in the ground to help the people. That's something, and that's all because of the preparedness and the safety, or you know, the way we are careful, the way our team is trained, and thank to Sydney team that making us very cautious and very careful. So that, you know, the preparedness, I would say, what is the one success is the preparedness, and that made us, you know, able to handle this. You know, otherwise it's a huge crisis if we don't have a basic gear, basic, you know, basic PPEs or things, or medicine is not in the place. Then that having 36, you know, people, you know, COVID positive in this, you know, in my background in this school, you know, it can be a big disaster if you were not well prepared. So I would say preparedness, community preparedness, school preparedness amongst our team members and healthy staff is a kind of, you know, major success. And yeah,
Absolutely, that's great. Thanks, Prahlad. I'm going to hand back to Angjuk now to look to the future for us, Angjuk. And as I said, we've just finished our planning, and there's so many exciting things in the works for Nepal next year. But can you share one thing that you're really excited about from our 2021 plans?
Absolutely, Maddie. Looks like we still have this COVID challenges in 2021. So our number one priority will still be to really how we mitigate and prevent the spread of the virus, COVID virus, in the communities that we work, and making sure our staffs are being put into safe. At the same time, to making sure all the essential services that we do in our communities are continue to go forward. So these are sort of overarching goals for 2021. We can't really get over this 2020. It's been a disaster year, but at the same time, it's been a learning for us. We learn a lot, and so some of the I hope if things get back to normal, we have so many things to do. We are so excited of it, and I had the opportunity to go to Uganda last year, 2019, and I had the opportunity to see our wonderful maternal child health projects in Chuoko Hospital. So so something, like if things get back to normal, we are so looking forward to replicate some of those projects in Nepal. Something like we really want to build a fantastic birthing center in one of the some of the project villages, because we still are struggling with the institutional delivery in so many remote villages in Humla. So we really want to have a fantastic birthing center, learning, replicating all those knowledge that we have in Chuoko Hospital and Uganda. So basically, to really improve the institutional delivery, and improving the maternal child health with all kinds of interventions. Basically, like regular antenatal checkups, or postnatal checkups, or exclusive breastfeeding, family planning, all.
We can still hear you, Angjuk. I don't know if we just lost you on the internet. Potentially we did. I think I
can continue.
Sure, we're probably going to wrap up in a minute, but is it anything you would like to add about next year, Prahlad? Please feel free.
Yeah, I think we definitely would like to do the a fantastic inclusive birthing center that, not only birthing centers, a communication center also, that communicates lots of positive message or health message to the community. So we are thinking of a kind of a place, a birthing center, but at the same time connected to the ladies, ladies related health, menstrual hygiene, reproductive health, their body, their rights, their sexual rights, sexuality, everything. We want to make a center where this is a birthing center as well as a center that communicates very essential messages for especially for the woman and man as well. We want a very sensible man who are very supportive to the ladies. So this is the center we dreaming for. And second one is definitely we have great successful education projects in Humla, and we want to utilize all those hands-on knowledge in other place, and we already started in Gangpeti, which is going great, and we want to replicate more of that successful knowledge of Uganda in health and of education from Humla to other places like Gangpeti. So these are the things we're really excited to do in years to come.
Thanks, Prahlad, and thanks, Anjuk. Sorry we lost you for a moment there. I'm also excited about this. I think we talk about our two areas of expertise, and it's such an opportunity for us to share knowledge across them. And I think I loved being in Uganda with Anjuk and the team last year, and I'm excited to see some of that learning from Uganda reach Nepal and vice versa. I think we have so much to offer each other. So that's a very exciting part of the plan for next year. All right, I'm going to move into the Q&A session now. So people in the audience, if I've seen a few questions pop up in the chat, if you have any questions, please feel free to put them in the chat box or in the Q&A box, and we will open up to questions now. So the first question that we've received is from Nora, and thank you, Nora. We have the great pleasure of taking Nora to Nepal in January, right before COVID really exploded. So it's wonderful that you could join us here today. And Nora had a question, and I might start with you, Dan, first. For the rest of the world, when COVID really hit hard, internet and connectivity became so important. That was how we could keep in touch when we can't see each other. How have you managed with unreliable internet to keep in touch with everybody this year?
Thank you so much. That has been not so easy, but one of the Adala's priorities is communication is key for us. So we tried all possible ways. If it means a phone, if it means buying a router, if it means buying a Wi-Fi. So we were able to look at possible options. And I must say we have been able to communicate, though sometimes we have had challenges. And when we plan a meeting, until it is done, we can't call it a meeting. So we come to a meeting when we know things might not work out well. So the expectation is always a little bit lower, but we know it works. So we have been having ups and downs, and I must say we have been able to communicate, though challenges sometimes. Yeah.
Thanks, Dan. I think from my perspective, I think it's been amazing in some ways that, for instance, when we just did our strategy planning, even with unreliable internet, we were able to bring all of the team into these sessions because we were online rather than together. So it has also created some opportunities for us this year. Prahlad, I'm going to ask you the next question, which is also from Nora, around whether there's been any drop-off in students attending school or women seeking medical care because of COVID-19.
No, because of COVID, the school is closed. So school attendance is not possible at the moment. But yes, we did 2-3 different type of education, distance education. One is from local FM radios in Humla. We started, and we're still doing it, and we started it, and then let's not use the word pioneer, but the education is there. But we're the first one to do it in, I think, in Nepal, and still to continue that. So that one, we complemented all those classroom. Coming to school is not possible. Just opening a school, we had a big result, a big impact just now. So we're going back to close down the school again in all of Humla, and so we started learning units. For example, 10 learning units in one village, so that the elder kids teach the small kids with the social distancing, cloth masks. We provided cloth masks, so all the protection things at the same time. you can have a social distancing mask and then small learning units like a 5, 6, 10 kids in one place with a proper social distancing and mask. So actually, it has other type of success that we learn ourselves as well. It works, and also like a home learning kits, with the radio and all these things. So I think school rate is definitely, school is not open, but education rate, it has been more inclusive as well. And
So-
also mobilizing volunteer and youth in the community, and those youth who are in the colleges are closed. So we've been able to mobilize the youth as well to teach the smaller kids, mentees and all
Yeah.
this. It worked very well actually.
It's been
So-
brilliant, Prahlad. Angjuk, I see you have your hand up. Did you want to add anything to that comment before I hand to Dan?
Absolutely. But some of the kids, those who graduated from the schools that we work, normally up to grade 10, and the kids come to school and then they graduate and they go for higher education. Those section of kids, some of them were affected from this pandemic. They finished the schools in homeland. Many of them really wanted to go for higher education in the cities. So basically, those are the ones have been really affected. So that's one issue. And in terms of health, the health seeking has been affected immensely, both in Humla and even in the cities, especially because of the fear of the COVID. Unless you are really, really serious, nobody really want to go to hospital to seek health issues. So this health thing has been really impacted by this pandemic.
Thanks, Angjuk. That's a nice segue into, I'm going to ask Dan the same question. Dan, what kind of an impact have you seen on health-seeking behavior or the health of people in the community due to COVID?
Thank you so much, Madi. I have seen quite a number of issues out of that. And one of them was when COVID came, most people, their source of income was hit. For example, if somebody was doing a small business, he could no longer work. And that means there was no small income. That means I didn't have any transport to go to the hospital. Even if I wanted to go, I didn't have the money. But also fear. If I go to the hospital, maybe I need to have a little money with me, but I don't have any money. So there was that piece, and I've seen quite a number of people struggling because of that. They can't earn, so they can't travel, they can't go anywhere. But beyond also that, there are so many issues that came around in terms of COVID, because children are at home, the consumption of our daily, what we need to use at home, really the rates was increasing. I was seeing parents struggling because their children at home, and that means the feeding habits even we are changing, but also nutrition, because there is no way how you can get the food balanced, because you can't earn, you can't eat what you deserve. And that has impacted negatively in many ways, with so many issues coming up. And I have seen also delays, moms coming to the hospital to deliver, and they come when it is too late because of issues on the road. When we had the lockdown, there were no borders. The transport, means of transport, which is the cheapest border for everybody. So that meant mothers were delayed, either had to deliver on the roads. I saw mothers deliver on the roads. But until the lockdown was lifted, but still issues kept coming. So that impacted in maternal in many ways.
Thanks, Dan. I think, yeah, the secondary impacts of COVID, we'll still be seeing the impacts of this for many years to come. And a lot of the forecasts are quite scary about the delays in seeking healthcare or avoiding immunization or not being able to access your medication for HIV. We're expecting to see some quite significant health impacts in the coming year and years. And so that was a really important question. Okay, so my next question is, I'm going to ask Dan first and then ask Prahlad and Angjuk if they have anything to add. COVID's been quite a burden, particularly for health workers. They're carrying a lot of stress and a lot of anxiety. How are you seeing people manage in Uganda, and how are you helping them? How is Adara trying to help them through this time?
Thank you, Madi. I must say that Adara is doing quite different things with Chok Hospital and other people that we work with, but particularly what I'm seeing, Choco Hospital leadership, with Adala's leadership, for me, the communication piece is very important. So we have regular catch-ups with Choco Hospital administrators, with Adala, and that, for me, means a lot because there is sharing ideas, focusing on what we need to do, prioritizing, planning, and these meetings cause things to happen because we are talking as leaders, and that's so important. And we do this, there's a weekly, twice a week, and that has been so fruitful. But apart from that, the engagement of the staff with the senior management of Choco Hospital, there's that communication chain where they share ideas on a weekly basis or daily basis. They have technical teams on ground to check on the staff, get their views, how do we improve, how do we do this? But apart from that, above all, Adala is focused on making sure that Choco has enough PP. If it is masks, if it is this, make sure that they have what they need to use. And that is very key and is a priority for Adala. No matter what it will mean, no matter what it will cost, Adala is focused and is working hard to make sure with all friends globally that Choco has enough resources. It's not all about resources, those ones, PP. We have gone ahead to see where we needed to change things in terms of spaces, where mothers, we are coming together, then work with Choco. How do we increase the space we have? So we had to buy tents. We have to be innovative working with Choco Hospital. And this is so amazing because I don't think all hospitals have this opportunity of working together in this deep partnership. So I think that's part of what I can say, but it's a huge thing that we are really involved in. And I'm seeing great results on ground, which is so encouraging.
Thanks, Dan. Prahlad, a question, or Angjuk, either of you could answer. Dan mentioned before one of the challenges being nutrition, that people are having issues with food security because of COVID. I know there's been a similar challenge in Nepal. Can you talk to us about how Adara has addressed this through COVID?
Sure, let me, especially the Humla region that and Gyangphidi also, those are very food insecure region. Humla in particular, it's a food insecure region heavily dependent on World Food Program for subsidized rice. So with COVID, we basically Humla, we border with the Tibetan border, not very far from the many of those villages that we.
Prahlad, would you mind jumping in? I think we lost Angjuk again. You're on mute, my friend. If you could unmute, that would be great.
Yeah. Okay, sorry. I think nutrition or food security in general is a huge challenge in Humla. In Humla, I think it's in whole Nepal, Humla is the food challenged place, food insecure place. So, and also other area we work, other remote area we work, Gyangphidi, such as the similar situation. A little less, but almost similar situation. But yes, for three things we did for to address nutrition challenges. We have a decade, more than decades long experience working on a greenhouse, helping people to grow their the vegetables, basically the supplement food, to grow that. Each house greenhouse has been one of successful projects in Humla. So that complements lots of food. Other than grains, you can really grow all the vegetables. That's one thing, which is very important. Another thing is food education. This in COVID time, we thought, it's very important to talk to people on food habit and food education. That is, good for your, for the community's nutrition status. So we did a massive training on food habit and how you can utilize your land other than greenhouse, how you can better utilize the land so that you really can, you really can, solve the problem on nutrition and food. So we did that. And we also do like lots of, plantation, especially fruit plantation. The trees we planted is already started giving apples, so all those things we are doing. But in COVID time, we thought like we have to talk to the people. We have to interact with the people in an organized manner on, nutrition, how we really can utilize greenhouse, your land, and also knowledge on food habit, so that you really utilize your local ingredients in a better way.
Thanks. Yeah, I think it's been a really successful project this year and hopefully will help with some of those food security issues. There's a great question here from Dr. James that perhaps you could answer, Prahlad, around, Dr. James said it's a great innovation using the FM radio for education. And do we have any locally developed study materials for radio? So what are we using on the radio? And how are we getting feedback? And would it be possible to get feedback from students using mobile phones?
I think, yes, it is locally developed and also the government curriculum. We have a central government curriculum and district government curriculum and also local language and locally developed, the curriculum. So we have all those mix. You have to also meet the, national curriculum, and they keep, because the kids are actually measured at the end on their, their learning is measured on the curriculum based central, designed by the central government. So centrally, locally, both in terms of materials. And yes, through mobile telephone, kids can ask questions to the teachers in the studio. And also there are some, 3 or 4 students in the studio with the social distancing and mask who can ask the question for the larger number of the, kids listening. So we estimated that 30,000 kids, the radio education were benefited 30,000 kids in a whole area.
It's amazing.
Radio has a huge
reach,
coverage.
Yeah, thank you, Prahlad. Yeah, I think you're right. I've got a question here from Betty about whether, when the vaccine candidates are eventually ready, how do you think that the community will accept them? Do you think they will be accepted by the community? Will people want a vaccine? Dan, can you start on that question, and then I'll ask Prahlad.
Thank you, Maddie. Thank you, Betty. I think about the vaccine, when that time comes, the approach would be education and sensitization. We have had many vaccines, and that has begun by educating the community and sensitizing them. We have the HPV going on now. There are issues in the communities when you go deeper, where people still shy away from vaccines, and they have misconceptions about these vaccines. And there are sometimes when where mothers will say, no, don't do this to my mother, to my daughter, my son. I mean, you can't force, but the education piece, sensitization, but I know it will be welcomed because everybody knows with a vaccine, then we can go back to normal. But it's not going to be straight away. It will take time. Yeah.
Thanks, Dan. I think that's the same most places. Prahlad, what about in Nepal?
No, I think people are eagerly waiting for the vaccine. That's the general sense I get. And a majority of the people, our education level and awareness level about vaccine is very low. I'm talking about the educated ones who knows about the, the vaccine development in the world, what's going on. They are, seriously waiting for it, and there will not be resilience at all, I think. But, lots of people, majority of, villagers, where 80% of villagers, they don't they are not too into like a vaccine discourse.
Okay, great, thank you. All right, we have time for one more question, and I'm going to ask each of you the question. We're seeing around the world a bit of, in some parts of the community, some doubts about COVID or some not acceptance of COVID, and people taking risks that maybe they shouldn't take. How do you think we can best change the communities we work with so that they remain safe in 2021? Prahlad, do you want to start?
I think 2020 or 2021 and 2020, the few months left for 2020. I think we the first still we talk about, we still work with the community to behavior change on so COVID has a long-term impact. It's not just vaccine. Vaccine comes, and we are sure that vaccine to come to Nepal takes a long time, and go to Humla it takes a more long time. That's what I assume. And then for that, the most important thing is a behavioral change amongst us, amongst the people we work with. So they are very important. They are in the the kids student, teacher, woman, elderly, everyone is a center of our work. We will be working more on behavioral change so that they practice basic safety measures. And it's not just COVID, it will prevent a lot of disease if you practice all those behavioral change. I think COVID also is teaching us something good as well. Hand washing. It's a diarrhea and hand washing is so connected. So I think we work on the behavior change. By and large, we'll do our projects, our continue with our education health, we'll continue that. But at the same time, behavior change is the center of our work for coming years.
Brilliant. And Dan, do you have anything to add to what Prahlad has said?
I think I agree with Prahlad. Thank you, Madi. COVID is here, and the challenge, I think, for all of us, equally everybody, is now to work with our communities. I hope best to live with COVID. It's not going to be easy, even now it's not easy, but looks like we need to be prepared how we are going to empower communities to live with the pandemic. Nobody has a mask, but you encourage them to have a mask, and you have to have a mask. I mean, it's going to be ongoing, a compliance issue globally, which is not going to be easy, but we are prepared to do that. Yeah.
Excellent. Thank you both. Well, we're coming to the end now, so I just wanted to wrap up to say a huge thank you to our panelists, to Dan, Prahlad, to Anjuk, to Odette, and to thank all of our amazing audience for joining us today. I think these people are all incredible, and I could ask them questions all day, and sometimes I do that to them because they know so much and have so much rich knowledge about their communities and the work that they're doing. And I'm really grateful that they could, in the midst of crises in both countries, that they could all make the time to be with us today and share their incredible expertise. I think we've got a really exciting year ahead, and we are not shying away from the challenge, and we are going in with our eyes open. But I think I'm really proud of the team for being so ambitious in spite of that, and to have a vision that's so much bigger than our instinct is to freeze in a crisis like this, and none of our team have done that. They have just figured out ways to keep pushing on, adding new things, building on the work we're doing, innovating the work that we're doing so that we can do it safely. And I'm just incredibly proud to work with all of them. So thank you, everybody. And thanks for joining our first webinar. We hope to do these again in the future. And we're just, very grateful for all of you for being here today.
Yeah, thank you, everybody. Please stay safe.
Thank you.